This is the In Focus podcast from The Hindu.
Hello and welcome to another episode of the Hindu's In Focus podcast. I'm Zubeda Hamid, your host for today. 2 weeks ago, the World Health Organization released a set of guidelines recommending the use of lower sodium salt substitutes. These products reduce the amount of sodium chloride in the salt, replacing it with potassium chloride. Reducing our salt intake, or specifically our sodium intake, has long been held by experts as one of the easiest and cheapest ways to reduce our burden of non-communicable diseases. The WHO's recommendation is 5 grams of salt a day, but Indians eat far more than this at around 8 grams per day. Think about this. An estimated 1.89 million deaths every year globally are associated with consuming too much sodium. And India bears a huge burden of these deaths. So what are lower sodium salt substitutes and how can they help? Do we need to reduce the salt used while cooking our food? What about food consumed outside the home and ultra-processed food available in supermarkets? What are the costs of lower sodium salt substitutes, and does India need a countrywide program to help people make this modification to their diets? We discuss these issues and more with Dr. Vivekanand Jha, Executive Director, George Institute for Global Health India, and past President, Indian Society of Nephrology. Good morning, Dr. Jha, and welcome to the Hindus in Focus podcast.
Good morning, Zubeda. Thanks for inviting me to speak with you and to highlight this topic. This is very important. So thank you again.
Doctor, following the WHO's recommendation on the use of lower sodium salt substitutes, could you explain to us what salt, or specifically sodium, does to the human body?
So at a very high level, salt has been shown to be one of the most important risk factors for premature death and disability. According to global surveys, high blood pressure driven by excessive salt intake is responsible for almost a quarter of all cardiovascular deaths, specifically in India. And this number could be anywhere between close to 2 and 4 lakhs in India every year. This is going to double in the next about 5 years or so. So we are looking at a major global health threat, specifically in India as well. Now, coming specifically to what it does to the human body, there are 2 types of effects that we can think of. One is the short-term effect, and the other one is a long-term effect. The short-term effect is more prominent in individuals who have pre-existing health conditions, such as kidney disease or heart disease. In those individuals, high salt intake leads to increase in sodium level in the body, which can lead to retention of water, which increases swelling, which progresses the development of kidney disease or worsening of kidney disease, worsening of heart failure, etc. On the other hand, people who even do not have any pre-existing disease, it leads to rise in blood pressure. Chronic high salt intake will increase blood pressure. It leads to hardening of blood vessels. And this combination of high blood pressure and hardening of blood vessels places strain in hearts, etc. This leads to increased risk of development of heart disease, which include both heart failure and coronary artery disease. It leads to increased risk of stroke, increased risk of kidney damage, and it can lead to increased risk of development of preeclampsia in pregnant women. In addition to these major health threats, there are other health threats as well, such as the weakening of bones because of calcium loss and increase in the risk of development of kidney stones.
Thank you, Doctor. That was very comprehensive and a little scary to know how one small thing in our diets can influence so much in our bodies. Tell us a little bit about the salt intake among Indians. In 2023, the ICMR had said that the average daily salt intake was 8 grams per day in India, much higher than the WHO recommended 5 grams a day. So do we urgently need to bring down our salt intake? How is it? Is it uniform across India? Do some parts of the country eat more salt than they should? And why is it that we eat so much of it?
Well, the premise behind this question doesn't allow me to come up with any other answer except an emphatic yes. Because as I have explained, excessive salt intake, primarily because of the sodium content of the salt, is responsible for development of a number of non-communicable diseases leading to increased death and disability. India is, in fact, one of the top countries with excessive salt consumption, which makes reducing salt intake and, as I said, primarily sodium intake, imperative, health imperative. More than that, it is also a cost effective strategy to combat non communicable diseases. In fact, both the WHO and the Indian National Non Communicable Disease Monitoring Framework aims for a 30% reduction in population and salt consumption by 2025. But sadly, we are already in 2025 and we are nowhere close to reaching that target. The awareness about the harmful effects of high salt intake actually is quite low. Now, to your question as to where does salt come in foods in India? So, the main source of salt in Indian foods is the added salt while cooking and the salt that is added on the table while eating as well. We also consume a number of other special food items such as chutneys, pickles, papad, and such, which are very, very high in salt. In India, as in other parts of the world, the consumption of ultra processed foods is going up, and ultra processed foods have very high salt intake. Often we don't appreciate that food items that are not considered to be salty, such as biscuits, bread, etc., they are also very high in salt. And therefore, salt comes to us or in our body in a number of ways, both intended and unintended.
So the major thrust has to be in reducing the amount of salt we use while cooking and while we are sitting at the table and eating?
Correct. That's exactly correct. Because we in India still cook our foods at home, and the consumption patterns of food are widely different. So while there is some regional difference in the salt intake, essentially all parts of India are characterized by food which is high in salt. The average salt intake is, as you said, 8 grams a day, which is obviously higher than the WHO recommended 5 grams. And in some parts of India, it can go up to as high as 11 grams a day.
Tell us a little bit about the WHO's guidelines for lower sodium salt substitutes. What are lower sodium salt substitutes? How do they affect your health in the sense of improving it? How do they work? And who are they recommended for?
As I said, the main culprit for increased risk of cardiovascular disease, premature death and disability, etc., is the sodium content of the salt. And what we need to lower is exactly that, sodium. Therefore, what substitute we need to look for are salt substitutes which are low in sodium, but very importantly, they should not alter the taste of the salt that people are used to. So that really is the key part. Research has shown in the past that replacing part of the sodium chloride content of the salt with potassium chloride or magnesium sulfate can actually be helpful in this regard. However, magnesium sulfate, the taste is bitter and therefore it is not preferred as a substitute. That leaves us with sodium chloride and potassium chloride containing salts as the ideal low sodium salt substitute. So that is what the researchers recommend should be provided to people to use in their cooking and for preparation of other types of food.
Well, how does potassium chloride? So you said sodium is the main culprit, that is the major factor behind the rise of non-communicable diseases. If that sodium chloride is replaced by potassium, then the effects are not as bad?
They are indeed not as bad. And the suggestion is not that all the sodium chloride is replaced by potassium chloride, but the suggestion is to replace about 1/3 of the sodium chloride content with potassium chloride. That is ideal because it doesn't alter the taste of salt and it also reduces the sodium content. An additional benefit is that we get potassium in our diet. So it is not widely known that potassium content is good for cardiovascular health. We and many other researchers in India have shown that the potassium intake in Indian foods is actually much less than recommended. Therefore, use of low sodium salt substitutes, which are fortified with potassium chloride, will actually kill two birds with one stone. It will reduce the sodium chloride intake, but also it will increase the potassium intake in the body, which is good for human health.
Can this be taken by everybody? The lower sodium salt substitutes replacing sodium chloride with potassium chloride?
That is an excellent question and often the major topic of debate. According to the evidence that is available on the basis of large scale studies done in multiple countries around the world, low sodium salt substitute, which is rich in potassium, can be taken by a vast majority of population. The population groups for which it is slightly risky are people with advanced kidney disease and people who may be taking medications that prevent the loss of potassium from their bodies. One of the risks of high potassium salt is that people with advanced stages of kidney disease may not be able to excrete potassium from their bodies. That can lead to accumulation of potassium in the body, which can be sometimes harmful for human health because it increases the risk of immediate rhythm disturbances of the heart. However, it needs to be emphasized that this is likely to happen only in a very, very small proportion of people who have very advanced stages of kidney disease. Kidneys are very resilient and they have high degree of adaptability. And even if people have early stages of kidney disease, they really are not at risk of developing any complications by taking this high potassium salt substitute. So therefore, our recommendation is that the low sodium potassium containing salt substitutes be made available to general population while keeping in mind that people with advanced kidney disease should take care and seek physician advice before deciding whether or not this kind of salt is appropriate for them.
Right. So, in general, a wide majority of the population can use potassium salt, but for those with advanced kidney disease, it is advisable to consult a doctor before they decide to make such a switch, correct?
That is absolutely correct.
Talk to us a little bit about the costs. Are low sodium salt substitutes more expensive than regular table salt?
So currently, the low sodium salt substitutes that are available in the market are indeed more expensive than regular salt. But if I step back and present to you some data which shows, on the basis of modeling which was done by our colleagues at the George Institute for Global Health, that if the salt that is consumed by people currently is replaced by low sodium salt substitutes, this will lead to almost a cost saving of 123 crores over the next 10 years. Over the lifetime of the population, it will prevent 60 lakh deaths from cardiovascular disease and chronic kidney disease. It will prevent the development of almost 2 crore new heart events and almost 50 lakh new development of chronic kidney disease in people. So then, just keeping that in mind, it makes a lot of sense for the governments to try and reduce the cost of low sodium salt substitutes by perhaps offering subsidy, by perhaps offering tax benefits to the companies that are going to make the low sodium salt substitute.
Let's circle back to something you said earlier, Doctor. We talked a little bit about how many people don't realize the amount of salt they consume because it comes from so many sources of food. And we talked a little about ultra processed food and the increase in its consumption in India, especially over the last decade or so. Talk to us a little bit about that. The recommendation currently from the WHO is that lower sodium salt substitute is recommended for home use during cooking and while you're eating at the table. But not for processed food or food eaten outside of the home. But is this a place that also needs regulation in terms of sodium content? Because as we know, many Indians are eating food outside the house, and the rise and the consumption of manufactured and processed food is also on the rise.
Absolutely, that's a critical point. As you said, the consumption of ultra processed foods is increasing almost every year, and it is going to all corners of India, including in rural areas where this was not very popular, at least in the past. So there is really an important and clear need for developing regulations which strengthen the front of the pack labeling to ensure clear identification of sodium content in all types of processed foods, and that they should also include health warnings, especially the processed foods which are packaged and sold in supermarkets. There are now need for studies that look at these front of the packet labels to see how granular they are in terms of the advice that they provide to people, and do they get an idea about the potential health risks from consuming these ultra processed food items. So we agree completely with you that there is a need for the regulators to ensure that the health threats due to these ultra processed foods are recognized, and that we take steps to ensure that people are made fully aware of these health threats and what can they do to reduce their risk of developing complications related to high sodium intake. Now, it must be recognized that not all ultra processed food items are equally salty or have equal amounts of salt. So there are some healthier substitutes, and there are now ways for us to recommend that people prefer those healthier substitutes. There are apps that are available. For example, there is an app called Food Switch that allows the users to scan the barcodes of any ultra processed food item, and this will give them information about the various composition of the various items in that particular item, and it can tell us even if there are healthier options available that will perhaps contain less sodium.
You talked about the importance of front of pack labeling, Doctor. Do you think it's necessary now for high fat, high sodium, high sugar products to be labeled so that consumers, especially in a country like India, are far more aware of what they are eating?
It is absolutely essential. I agree with you there, because only when people are informed can they make choices, appropriate choices, and improve their health. In addition to the labeling, we also need to increase awareness of what the labels have. The labels should contain appropriate information which allow people to make right choices, and then do advocacy to make sure that people get this information as well.
Circling back to salt and our use of it, Doctor, now during the 1950s and 60s, when the iodine deficiency was a huge problem in India, the government decided to fortify salt with iodine, and then this became widely available and a huge public health campaign. What will happen if you're going to do a lower sodium salt substitute? Will this affect the iodine content? Do we still need to have as much iodine as was recommended in the past?
Right. So this is often a misconception that if we replace the currently available sodium chloride salt with potassium chloride containing salt, it will affect iodine fortification. That is not the case at all. Iodine fortification can continue in the same way as it is done today. A minor modification in the process of fortification is all that is required, and people will continue to receive the same amount of iodine as they are doing today.
So this is not going to be an issue at all.
Not at all.
Would you say, in your opinion, that this needs to be yet another public health campaign, hopefully supported by the central government, to push lower sodium salt substitutes with, of course, cost-cutting measures in order to stem the massive burden of non-communicable diseases we have?
It is our firm belief that this is one of the most effective public health measures that we can take to reduce the relentless progression of non-communicable disease burden throughout the world, especially in countries like India. Chronic kidney disease is something that is close to me because I see patients with kidney disease on a day-to-day basis. Kidney disease is increasing year on year in India. People develop more advanced types of kidney disease, which is very expensive to treat. And as I said a little earlier, the cost effectiveness of simply reducing the current sodium chloride containing salt with low sodium salt substitutes will go a long way in reducing the burden of chronic kidney disease. Now, where do we see the greatest benefit? The greatest public health benefit is going to come when the commonly available salt is replaced by low sodium salt, so that is what people use as a default option. Of course, people should have the option of making a choice if they want to. But if it is widely available, it is seen on the shelves all the time, it is placed at a level that it is easily visible to the eye rather than hidden somewhere in the back of the shelves in markets, etc., that will make it easier for people to pick it up. As I said earlier, the cost of it needs to come down, and ideally it should be costed the same as the currently available salt so that people don't have to pay out of their pocket. This is for something that the government should actually do, because eventually the government will end up saving a lot of money, and eventually it is taxpayers' money. So, it all circles back to us.
Thank you so much for speaking to us today, Dr. Jha.
You're most welcome. And once again, thank you for spreading the message of low sodium salt substitutes.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.